This week we're going to be talking about biopharmaceutics and pharmacokinetics. The key terms here are really important that you know these prior to taking any of your quizzes. So let's talk about it. Let's talk about how a medication or pharmaceutical gets from the bottle or the tablet, capsule, aerosol, into your body and to the area in which we're looking for it to help with pain or cough or whatever, okay? So looking at little Timmy, he's given an IM, intramuscular injection, and asked how will that get from there to my sore throat? The answer to his question is biopharmaceutics and pharmacokinetics, okay? So for a drug to produce an effect in the body, it must first reach the site of action, which makes sense, right? So we need it to go to the area of the body in which we want it to, okay? So biopharmaceutics and pharmacokinetics, this describes the process required for a drug to reach the site of action. So the process of taking a vacation. So you got to get on the flight, you got to pack, you got to get on the flight, to get where you're going to your destination, okay? So they view it like traveling. So biopharmaceutics, it's the area of pharmacology that focuses on the method for achieving effective drug administration. So manufacturers place medications into vehicles, okay? Substances into which a drug is compound for initial delivery into the body to help deliver them to the body. Okay, so there's a lot of different ways. There's stuff that's dissolved in the mouth. There's stuff that is slow release. So there's a lot of different ways that they use the vehicle to get to the target. Okay, the combination of the pharmacologic agent and the vehicle is known as the dosage form. So what is the dosage forms? A drug may be available in different forms to facilitate administration and action of the drug under a variety of conditions. So, common dosage form is a solid, a liquid, and a gas. So the solid is tablets, capsules, trokes, suppositories. A liquid is a solution, suspension, and emulsion. And a gas is oxygen therapy, anesthesia, and aerosols. Tablets generally consist of several components, including the active form of the pharmacologic agent, the chemicals that aid in disintegration process, fillers to help maintain the form of medication, and substances to help mask the taste of the medication may also be added to the tablet. So various types of tablets are produced to aid in medication delivery. So the types, there's compressed, sugar-coated, film-coated, intrinsic. Enteric coated. So compressed, compact with no coating, subject to chemical degradation. Okay, so it can not hold its form. So sugar-coated has a thin layer of sugar to mask the taste and prevent against oxidation. Film-coated is coated with a material other than sugar to mask the taste and prevent against oxidation. It's less expensive, so a lot of times they'll put like a little lubricant on it so that it'll slide down easier, okay? Enteric coated passes through the gastric acid intact, okay, and releases contents into the small bowel, prevents degradation by the stomach acids. Also prevents gastric upset, so that's a good thing. So it goes straight to the small bowel before it starts to dissolve. So multiple compressed and controlled release, so masks the taste, prevents against chemical oxidation, and releases contents in a controlled manner in the GI system. So a lot of medications have this. So effervescent contains sodium bicarbonate and organic acid. So releases carbon dioxide in the presence of water. So those fizzies that we give the patients to put out air in their stomach so we can see the lining really well. There you go. That's our effervescence. So there's buccal or sublingual. So it disintegrates in buccal or sublingual space. So you put it under their tongue, right? And it dissolves. So capsules. A powdered or liquid drug contained in a gelatin shell which dissolves in the stomach and releases its contents. So it has a hard gelatin capsule or a soft gelatin capsule. It's used to mask the taste and it's easy to swallow, and it's usually a controlled release mechanism. Okay. Troches, generally in the form of lozenges or pastilles, so contain medicine in a hard candy or a glycerinated gelatin base designed to dissolve slowly in the mouth. Typical oral antifungal or anesthetic, and are most often placed in this form for continued contact with the oral mucus. Okay, so we use these a lot for cough medicines. So, we pop in a little, cough lozenge, and that helps us. So that's the most typical. So there's compressed suppositories or inserts. So these are shaped for insert into a body orifice, rectally or vaginally, and the body temperature causes them to melt and release. So there's liquid dosage forms. They can be administered by oral routes. So there's solutions, emulsions, and suspensions. Solutions, a homogeneous mixture of a solid, liquid, or gas that is dissolved in other liquids. So the solution, the drug, is dispersed in the solvent, which is the vehicle. Okay. An emulsion, so containing of two emulsible liquids. So one liquid appears as globules, uniform, dispersed throughout another liquid. So generally requires emulsifying agent for stability. Then we have a suspension, which is most of our bariums. Okay, so it's a mixture of a solid medication into a liquid medium. So suspending agent is added to help maintain uniform dispersion. Generally requires agitation before administration. So as you know, when you get your barium, you got to shake it up because all of the product, the barium in the suspension, settles to the bottom, right? So a suspension should never be administered intravenously. Don't inject this into a vein. It is, or artery, very bad. Patient most likely will die. So parenteral drug forms, so administered by routes other than the GI system. It's given by injection, under or through one or more layers of the skin, and therefore requires drug prep to be free of all contaminants. So the drug vehicle is usually a solution, suspension, or emulsion. The routes are subcutaneous, intradermal, intrathecal, intercisternal, intramuscular, intravenous, and interarterial. So we do administer intravenous in radiology. So gas dosage forms. Typically used for oxygen therapy, anesthesia, aerosol inhalers. So we deliver oxygen. It's considered a drug. It's a gaseous at room temperature and does not require dispersing agent. There's anesthetics. It's gaseous at room temperature. There's inhalers, contained liquefied medication dispersed in a gas propellant into the respiratory system. So disintegration and dissolution. So medication is absorbed in either liquid or gaseous solution. Any solid or semi-solid drug must first enter into one of these solution forms before becoming absorbed across the cellular membrane. So medication in solid form requires one or more to enter the body than the liquid form. Disintegration and dissolution constitutes the beginning of the pharmacokinetic process. I should say pharmacokinetic, sorry. So solid drug absorption. So you have your tablet. Then it goes into disintegration granules, and it breaks down into smaller particles to a solution and then is absorbed by the small intestines. Okay. So rapidity of absorption of various dosage forms, so dosage forms. If we look at what is the fastest versus which is the slowest, and this is important in the sense that you need to understand how quickly it's going to be absorbed in the body and take effect, okay? So if a patient takes a pain pill versus given an IV dose of pain medication, there's going to be a big difference in the time, okay? So even anxiety drugs. So if you look at the fastest is a solution all the way down to an intrinsic coated tablet, which is like a slow release, okay? So pharmacokinetics begins immediately upon administration of the medication. The process of how a drug is absorbed into the body, circulates within the body, is changed in the body, and leaves the body. These parameters determine the onset, duration, and extent of the drug action. So pharmacokinetics. You take the pill, then we need to look at absorption. How will it get in, okay? Metabolism, how is it going to be broken down? Is it a first pass drug where it's going to go to the liver? Is it distributed throughout the whole body? So how is it going to transport? What's it going to connect to transport throughout the body? Okay. So let's look at absorption. Drugs must be absorbed or administered intravenously and taken through the bloodstream to its intended site in order to begin activity. So drugs administered intravenously bypass the need for absorption, so they're quicker, okay? Numerous anatomical sites can be used for systematic drug administration. In order for absorption to occur, properties of the drug and vehicle must be compatible with the site for administration. So the rate and extent of a drug absorption depends on dissolution, surface area, blood flow, concentration, acid-base properties, liphophility, so it's attraction to fat, and compatibility. So one thing is we give epinephrine, right, when a patient's coding. If we do not circulate the blood by doing chest compressions, it's not going anywhere. So that's why we give the drug, why we're giving chest compressions to circulate the drug through the body, okay? So dissolution properties and the dosage forms. So drugs can be absorbed into the systemic circulation at various sites, including the skin, gastrointestinal tract, the lungs, subcutaneous tissue, muscle, and or mucous membranes, okay? So a solid or semi-solid drug must first enter into a liquid or gaseous solution form before being absorbed across a cellular membrane. Surface area. Parts of the body that contain the largest surface area, such as lungs and gastrointestinal tract, provide better absorption of a pharmacologic agent than those with less surface area. So, what could reduce the absorption of these areas? One would be any kind of barrier and lack of circulation, right? So, blood flow. The quantity of blood flow to absorption surfaces affects the rate at which a drug is absorbed. So, blood must be flowing to the absorbed surface in order to allow entry into the systemic circulation. Okay, makes sense, right? Increased circulation results in optimal absorption. So patient in shock has decreased circulation. Okay, so the gastrointestinal tract, and thus can be expected to have a lower rate of absorption than a healthy patient. So if a patient is crashing, what we call crashing, so they're going into shock. When you give any kind of medication, what the body does to preserve itself is not take the drugs from the GI system, okay? So the GI system is not working like it normally does, okay? So you need to give IV drugs, okay? So if you give something orally, it's going to take even longer before it starts to work. So the real important thing is, you need to make sure you have blood flow. And if a patient's in shock, their blood flow is, number one, reduced, and the heart rate goes up, but yet there's no circulation going to the GI tract, okay? If you're giving medication for a patient that has necrosis of some sort, okay, and you're trying to give a drug to increase circulation to that area, if it's dead, you're not going to get circulation to that area, okay? So if the part of the bowel is gangrenous and is dying versus inflamed, So if it's inflamed, it has increased circulation versus dead has no circulation. So, you have to kind of look and weigh out how you're going to administer the drugs, especially if a patient is coding. Concentration. So drug concentration also affects absorption. So drugs move to their site of absorption and then must penetrate the cell membrane at that site. This can be done through various methods. So there's passive diffusion and active diffusion. Passive diffusion is the most common manner in which drugs cross cellular membranes. This method moves drugs from an area of high concentration to an area of low concentration. The concentration of the drug at the site of administration will influence the rate and extent of the absorption. Okay, so this just happens naturally. So passive diffusion, you can see here the movement of a drug across a cellular membrane in the direction of the highest concentration, pushing towards the area where the lowest concentration is, trying to equalize. Active transport, so it requires a carrier transport system. So drugs that use active transport contain a carrier protein that the drug attaches to. Okay, the protein complex actively moves the drug across the membrane and releases it on the opposite side. It's like a piggyback or a backpack, right? This system moves the drugs from an area of low concentration to an area of high concentration. So if we look here, you can see drug of high concentration attaches to a carrier protein, crosses the cellular membrane. Remember, it wants to equalize with passive, so it's going to equalize. We're going against the grain here. So the drug in high concentration carrier protein has released drug on the side of the highest concentration. So the movement of drugs across the cellular membrane can occur in the direction of low concentration, pushing towards the area of higher concentration. So let's look at acid-base properties. So acid-base properties of the medium affect the extent and absorption across the membrane. So neutrally charged or non-ionized particles cross cellular membranes better than charged particles or ionized particles. Most drugs are either weak acids or weak bases. Acid-base properties. So weak acids are non-ionizing in acidic mediums and ionized when in alkaline media. Okay? Thus, a weak acid crosses barriers best when in an acidic environment, such as aspirin. A weak acid in alkaline environment hinders it from passing across cellular membranes. So if we look here, we have effective pH on drug ionization and transport. So if we look at A, affects the pH of a drug, and B affects the pH of the transport of drug molecules through membranes, so the GI tract. So we have here a weak acid, so we have acid media basic, so we have non-ionized and ionized, and we have a weak drug in a weak acid. This is a weak basic, so you can see here how they transport through and cross the membranes. Lipocidity of the drug. So human cell has a double layer of a lipid, which is a fat. A drug must penetrate for absorption to occur. Okay. A drug must be made up of the same components as those at its intended absorption site. So a drug with good lipid solubility will cross the membrane. Water-soluble drugs will not cross. They must have some affinity or attraction to water, or they can't dissolve or be transported by the blood or other body fluids. A fat-soluble or liquid-soluble drug is unable to penetrate a water-soluble site, and a water-soluble drug cannot penetrate a lipid site. So exceptions is the active transport or pinocytosis. So the CNS, so the brain and spinal cord, is composed of these highly impenetrable lipid tissues. Okay, the blood-brain barrier makes the brain less easily penetrable by chemicals that might damage it. So only lipid-soluble drugs may bypass this barrier. The placenta is also composed of lipid tissue. However, the fetus is exposed to all drugs and toxins ingested by the mother. Compatibility with other chemicals or drugs. So some drugs interactions form insoluble participants, which decrease absorption. Barium does not cross the GI membrane because it forms insoluble participants. So barium is very toxic, okay, when given IV, but is safe when administered orally because it's not absorbed in the system at all, okay? Distribution. Definition. The movement of a drug from the bloodstream to various tissues and organs of the body and ultimately to the site of action. Once a drug is absorbed, it is immediately distributed throughout the whole body. So analogous with 2 aspirin taking a vacation. So in your book, they talk about that. So several factors affect the distribution. So 1, cardiac output, right? So if a patient's in heart failure, then it's going to take a lot longer for the drug to get distributed throughout the system. If they're a runner and they have really good cardiac output, it's going to go a lot faster, okay? Also, the regional blood flow. So if there's a restriction of some sort or inflammation or something that's causing a restriction of the blood flow or an increase in the blood flow to that area, that's going to affect it also. Also, the drug reservoirs. So the body has 2 barriers to distribution. The 2 barriers are the blood-brain barrier and the placenta barrier. That's for the protection. So if we look at drug metabolism, so biotransformation, okay? The chemical alteration of various substances or drugs into metabolites that can be excreted. So most drugs are metabolized by the liver. So there's also plasma, kidney, lungs, and intestines. Most are liver, okay? Second is kidneys. So several biochemical processes, including oxidation, reduction, hydrolysis, conjugation, and other occurred during drug metabolism. So drug metabolism can be comprised and prolonged, causing toxicity. If metabolism is delayed, it can appear as an overdose, okay? So what factors can affect metabolism? Oh my gosh, there's so many, okay? So you need to make sure that the patient's metabolism is normal or else it can build up. Or if the kidney or liver functions are normal, otherwise they can't metabolize and excrete the drug and it builds up in the system. Okay, so that's one way that some patients, especially elderly, have drug overdoses is that their kidney or liver function is down. And they keep taking the drug every 4 hours and then it builds up in the system and they get toxic. So first pass effect, drugs taken orally are transported through the liver before entering the systemic circulation. Because of this travel through the gastric and hepatic circulation, a portion of the drug is metabolized and becomes inactive. Thus, some drugs are administered via an alternate route. There's a good YouTube video for that. So first pass metabolism. So you take the drug, it goes into the lumen of the GI tract, it goes through the liver, and the liver starts to metabolize the drug, okay? And it starts to break it down to excrete it, okay? Before it goes to the general circulation. So if it's a first pass drug, it's diluted, okay? And you have to take that into account. Factors that influence drug action. So patient age, of course, someone young versus someone old. Health status, are they healthy or are they unhealthy? Are they in liver failure or not? Okay, the time of the day, okay? So your metabolism is different throughout the day. The emotional state, other drugs in the body. There's generic variations and the disease state of the body, okay? Excretion, the removal of the drug from the body. The kidneys are the most important organ for drug excretion. The kidneys filter the blood and remove the unbound, insoluble compounds. This is one reason drug testing is often done in the urine. So they usually do a urine test because the kidneys filter out the drug. Certain types of radiologic contrast can cause renal damage. The damage can affect the drug metabolism and excretion, okay? So there's some diabetic medication that does interact with the kidneys and with adding in the contrast can put them in kidney failure. So we have to be real careful, okay? All right, so excretion. Other methods of excretion include the intestines. So metabolism may be secreted into bile, pass to the duodenum and duodenum, and eliminated in the feces. The respiratory system. So gases and volatile liquids are eliminated via this route. Saliva, sweat, and breast milk, or breasts. Not the body's predominant mechanism for elimination. Okay, so if they are on certain drugs, it will show up in their saliva. So you'll see some saliva tests for drugs, but the most common is through the kidneys. All right, so conclusion. Biopharmaceutics focuses on effective drug administration. The various dosage forms include solid, liquids, and gases. Pharmacokinetics involves the manner in which the body affects the drug, and numerous factors affect the patient's response to the drug, which may be undesirable. Okay, so take a look at what all the different types of administering drugs are. Active and passive transport are really important. First pass, what that is. So make sure that you pay attention. Go through this video, look at the PowerPoint, read your book, answer the questions in the back of the chapter, and you'll do great on your quiz.